Well, I'm really excited to talk about that because it's been quite a journey for me. As you know, I'm conventionally medically trained, but since the beginning, I feel with my practice that felt like I was missing something with the ability to help patients. And I have my own personal yoga practice and meditation practice, and I think through those practices, I became aware of the healing powers of mind and body. And that actually led me to study Ayurvedic medicine, which, if you're not familiar with that, that's traditional Indian healing techniques. And I studied that for about a year and have my certification as an Ayurvedic educator. And I was hoping to integrate that into my practice, but I found it difficult in the conventional medical model to integrate the two together because they're just the paradigms are so polar opposite. But I kept going along my quest to try to find the perfect treatment paradigm that I felt would suit me and my patients. And as time went by, over having a very stressful job in academics from working very hard for many years, I myself happened to develop autoimmunity. And once that happened to me, and of course my doctor had offered me conventional treatment, meaning steroids, a medication that I would commonly prescribe myself, I looked at her and said, no thanks, I'm not taking steroids. And right then, that was very eye-opening for me because I said to myself, Julie, what a hypocrite. Okay, here I am not wanting to take the very medicine that I'm prescribing my patients. So from that point on, I started to look for every possible alternative, more natural option for myself that I could also bring to my patients. And what I've discovered that really fit for me and that makes the most sense for me are the principles of functional medicine and medical acupuncture and, of course, yoga and the mind-body connection. And I think this is what I call my practice of integrative neurology, is taking all the best things from my conventional medical training, my knowledge, my background, my diagnostic abilities, and combining it with more alternative treatment modalities, with mind-body, with nutrition and functional medicine, and with medical acupuncture. And I am of the belief that the results have to be far superior, because not only do I have this medical background in my favor, but now I have all these other tools that can really help me get to the root cause of the patient's disease and start healing from that level. Of course, there's always a time and a place for medications and other conventional medicine treatments. I mean, of course, they can be life-saving in certain situations, but for the vast majority of chronic disease, these kind of treatments are just sort of maintaining the disease, not really treating them at the source. And so that's what I'm so excited about, and that's what I feel really resonates with me, and what's going to really resonate with the patients is that we can work on this very specific individualized treatment plan, and we can really get to the root source of their problem. Of course, it means making a lot of perhaps difficult lifestyle changes, but coming to see me is really like allowing me to help you on your path to wellness.